Hi y'all, it's Jenny from her hillbilly state. Don't worry, I calmed down from the last video. Empress gave me some of her tuna treats, which helped a lot. Um, just wanted to this is part two on Baby G, and just wanted to give you the reason I was so triggered and so upset with what I had kind of saw with Baby G is that basically, and again, I blame my parents on this one. They instilled on me the love of history, and I've had the both the privilege and the sadness of taking care of Holocaust victims. Even though I live in a hillbilly state, I live in a metropolitan city that has a large contingency of a Jewish population, and some of them were Holocaust survivors, and I can even remember taking care of them as a nurse and seeing their tattoos on their arms, and they never spoke about it at all. But I do remember the one gentleman didn't speak to me, but spoke to another nurse. Basically, apparently he was a child in one of the horrible camps, and the only reason he survived is that the adult prisoners, the other adult prisoners, when they would line him up in the morning to do whatever count, they would stand right next to him and like basically prop him up, to the effect so he would look inches taller, so he would look older than what he was, so he wouldn't be carried off to the gas chamber as a child. And the symptoms of Baby G is just reminding me of stuff that I had read. And again, my parents, they absolutely, I was not, I had to learn both the good and the bad in history, and I'm forever grateful for them. But um, if you can remember some of these, when you hear about the Holocaust accounts, you hear about them after, after they had put them in the gas chamber and people that had to basically remove the bodies. They talk about foaming at the mouth and bleeding at the mouth. Well, that's acute lung injury. All right, and basically that's what's happening with a premature baby, and that's you do everything you can to prevent it. If you're seeing, and again, foaming at the mouth, what happened? You remember if it was happening to Baby D, which was the DIC and lung injury to that, and sepsis. But foaming at the mouth and bleeding at the mouth again, it happens in premature babies, and it could even happen under the best circumstances, and more than likely happened to Baby G. Could have been cared for by the best person. Again, what you do is you have to make sure that you are precisely putting that baby on the most precise ventilator. The ventilator center, maybe even a ventilator is not appropriate for this baby. Maybe you need to go to something called a CPAP, which is less invasive. Colin Morley, which is an incredible neonatologist who's just been nothing but on the side of Lucy, is one of the pioneers in there, and I'm going to include him in the description box, a video about him and stuff. He is one of the pioneers into, sometimes you got to go hard, but more likely you have to go soft. Baby G, we know, had to have a ton of blood transfusions even before she went to the Countess of Chester. And again, if you remember during the Holocaust, well, what did they do? Experiment on the Joseph Mengele, the doctor at Auschwitz, experimented on people. Well, this baby had to go through multiple intubations, and also I will describe to you later on another incident that this poor baby went on where, the combination of Hawkness and Gibbs, they put that baby through 7 needle insertions. That wasn't experimental surgery like they did in the Holocaust. I don't know what is. Plus, if you remember, many of the Holocaust victims had succumbed from typhus, which is basically a flea-borne, and I think that's probably just about the only pathogen. Fleas was probably the only thing that was not present at the Countess of Chester. However, I wouldn't be surprised if someone comes across and says there was this unit probably had fleas. I mean, it just, nothing now surprises me. And probably the saddest thing, and one of the saddest things, is that if the patients didn't die from gas, typhus, or malnutrition, basically what they died from, dysentery. And essentially, baby G had all the signs of someone with a severe gastrointestinal issue. And we all know, we've all had those, just how utterly painful they can be at the very start of it, and just the suffering. And I'm not in any least trying to denigrate anyone at all, saying, they went through the Holocaust. In fact, I have members of my family that are Jewish, and I myself did. You know how you do that DNA thing, you send it in. Lo and behold, I have Jewish DNA in me. And how we theorize I have it in me is that my grandfather was an orphan, and he was found in New York, and family lore was, or it wasn't so much an orphan, I think he was given up for adoption. Family lore is that it was a rich Jewish girl that came over from Europe to deliver a baby. This was, in the 1800s, when, premarital sex and unwanted pregnancies was the big no-no. And my own mother died from a polycythemia vera, which is a disease that is profoundly only found in Ashkenazi Jews. So I have that. I have Jewish blood flowing through my veins, even though I've never practiced Judaism and I was raised in a different religion. I have the utmost respect for the Jewish community and what they have gone through. And these poor babies, just like, they were transported there. They were, let's just face it, they were just used as the consultants, just allowed the trainees to run the asylum. And essentially what they were doing is they were experimenting on these babies, doing what they want, learning how to do it. Well, there's a time to where you can learn, and if you have that consultant or that extremely well-trained register at your side, yes, you want to train, you want to do it, you want to guide, but you do it in the most safe manner in that. And it's just so sad. And another thing that came back that we learned from the Holocaust was that something called the Nuremberg Code that I'll have in my thumbnail. And it basically says that it's all about now the idea of consent. You can't do research, you can't do anything on a patient without their consent or their parents' consent. Did these parents know how bad this unit was? Did these parents know that essentially these were researched on by untrained or unsupervised trainees? There was, to my mind, there was no true consent, and that's essentially what the Nuremberg Code is. And it essentially says you cannot do medical research or anything without certain protocols, and you have to go through things called IRBs and stuff, which is basically you got to present, if you're going to do research, you got to let an ethics board know about it, and they have to approve it. And if it's ever found out that you did anything unethical, man, that is big time. That was probably one of the first, along with penicillin that came about in the 1940s. To me, in my mind, the Nuremberg Code that came, and the specific points that came with this, was just as much of an important feat in medicine as penicillin. So what I'm going to do is, this first time I have seen the charts for this, and I'm kind of going to go through it with, me, Jenny, I just love to do me some chart auditing. So basically what this is Sunday at 11 o'clock on Brewery, and this is his note. Well, first thing I'm seeing here is this is an incomplete note. And the reason I say that is unless the register made a note in the previous page and went through a really good head-to-toe assessment and did everything that was supposed to do. That is part of the trainee's thing. Doing the medical documentation is scut work, and you can't learn how to do medical documentation without doing it. Now, if he signed it, or if he would have put on here reviewed history by doctor whatever, that would have been perfectly fine. What this is telling me here is that he just basically phoned in and looked at this kid at 10 minutes. Now, this would not be, even when I did my chart auditing, for my hospital. Even if we had a baby that was, very, very close to discharge, this would still not be adequate. This would be a big no-no. The only time a chart like this would look like this is if basically we have a baby that is perfectly well, never even set foot in the neonatal intensive care unit, stayed the whole time the cot with mom, the world's most perfect newborn baby, gorgeous, and basically the pediatrician kind of steps in once a day until that baby is discharged. It's a quick look, see how everything's going on. More importantly, he will definitely be checking those nurses' notes, checking in with the nurses. Is everything fine and dandy? Checking with mom and doing it. And this would be somewhat of a note that I would see that would just be perfectly fine. Now, let's just say this is a note from Shu Lee. Well, first of all, I'm going to say I'm going to give him a pass. A man of integrity. I'm going to say, I bet this was a day while all hell broke loose. There was so many freaking sick babies that if he had done a really long note, a baby would have died. Again, a man of integrity, or a woman of integrity, I should say. Who am I to judge their charting? But damn it, when it comes to someone like a brewery, well, you know what? The hillbilly in me comes out. So this is what we're seeing. Okay, this is the only obstetric history here, guys. Or what had happened with this baby. 23.66 weeks. Again, there's just some little doodad in here. That probably wouldn't give me enough. Well, where was all that shit that had happened that I told you about? All those bleeds, all that everything that happened in Arrow Park. The baby was in there for 10 weeks. A few sentences would have killed you. Okay, right here is just telling me chronic lung disease. Okay, that was that hyaline membrane disease, the interstitial lung disease I was talking about. Mild bilateral ventriculomegaly. Okay, it's telling me those ventricles in that brains were mildly dilated. All right, it happens. You're a baby. Okay, I'm not sure what this means here, but basically I'm seeing low something. I have no idea. Could this be could the baby be at low? 0.06 liters per minute? I don't know. Something DSATs. No overnight DSATs. Okay, so it's on low dose oxygen. Oh, yeah, okay, that's probably okay. Again, I don't know enough about a neonatal ventilation or oxygenation to say what is good or bad. If I have any questions, this is when I would walk into my, obviously making sure I wash my hands and watch out for that stalker infectious disease nurse. And obviously ask permission to enter during a quiet time, but I would ask, the neonatal nurse, okay, explain this to me. So it looks like, I think this is maybe feeds or fluids. It looks like it's getting 180 mils per day. And it's telling me it's getting both NG and bottle. Again, I'm going to question, were these feeds advanced too quickly? I have to say that. That's Express breast milk good. I think that's Gaviscon and something else. I don't know what it is. And I'm not going to sit there and, I'm not going to sit here and make you, normally I would pick it apart and see if I could figure it out, but there's not enough time here. I'm not going to put you guys to that. So it's taken oral and bottle. Okay, its weight has increased. That's good. And it's, again, it's up to 1,900 gram. Okay, its meds are on Gaviscon. I've told you about that before. It's on sodium chloride. Okay, I do know little premature babies, their little kidneys are immature, and they're, sometimes if you don't give them a little sodium chloride, they can get something called hyponatremic, which is really bad. So, okay, that's pretty good. Oh boy. I'm not sure exactly what this word means, or what this word says. I'm just taking a gander that it's furosemide, which is Lasix, which is a damn big diuretic. That has me a little concerned here. Again, I would go to the neonatal nurse or the neonatologist and say, explain to me. Now, the reason it would be on a diuretic is that it, with that interstitial lung disease, it's essentially, you have that chance of you have all this fluid in those around those little air sacs. Again, this is ding dong, a real powerful diuretic. So that, again, I would never question Shu Lee, but again, I'm questioning brewery. Now, this is spiraldactone, which is a real mild diuretic. Okay, that's good. And it's good because it's a potassium sparing diuretic. Okay, that's good too. Again, with the Lasix, you're losing potassium. Again, I have no idea. I have no idea what this means. I have no idea what that means. Again, this is supposed to be the exam. I'm thinking this is supposed to be the head to toe exam. You look at everything, all right? Unless it's an emergency situation and you got a kid that's dying 2 cots down, all right? And this kid is stable. But this is it. This is it. This is the head to toe. Bullshit. That is wrong. Unless there was a good head to toe on that previous thing, but somehow I am doubting it. Okay, so it says chest clear, which, okay, chest clear, yeah, that's fine. You listen to it. It doesn't mean it doesn't have lung disease. It just means you're not hearing any wheezing or rattling. And abdomen soft. Okay, good. Well, what's going on with the feeds? How is it moving? Is it grimacing? I could have you here for 20 minutes. What he should have been on here. And says plan, continue. I don't know what that means. To check on for, I have no what this means. And you know what? I don't even want to know because poor hillbilly Jenny is probably going to get upset. Okay, let's keep going on here. Okay, so here is that big, remember that big vomit that kid had? Here is the registrar here. So this is next morning, or Sunday night, Monday morning, Sunday night, 4 a.m., kind of a thing. Called to work urgently for child D at 2 a.m. Had very large projectile vomit, reaching chair. Okay, abdomen appeared discolored and purple and distended. Well, yeah, hello, ding dong. That happens when you have, when you have a distended stomach and it's painful, and you would see this, and you would see this in an adult that's got something gastro going on. Okay, child distress, yes, and uncomfortable, obviously. Red in face, purple all over. O2 increased to 1 liter. That's good. It was on that, 0.06 or 0.6 or something. Nasal cannula, good. DSAT to 80s, that's not good. But, the pain, poor baby was A in septic or in massive pain, and both will do it. Heart rate, okay, that's good. Full feed. Okay, so it was given a 45 mil aspirate prior to, so that it looks like the full feed aspirated. Large watery stool passed, after which abdominal siding better. Yeah, I guess when you have a big, baby relaxed and appeared back to usual self. Ooh, after having that kind of a situation, again, I would want eyes on this, better eyes on this. Yeah, if it was an adult, you could ask them, how you feel? But a baby, you can't. Again, there had to be something else going on. And again, someone experienced and someone doing it to, I want a better trained registrar or a consultant looking at this, just to say, all this going on here, and you got to increase the thing. Sirens are going off for Jenny. It says plan to cannulate, meaning put IV fluids in and blood. Okay, but she tells them not to feed the baby, which is absolutely correct. And obviously this baby needs IV fluids, but she can't do shit because guess what? She's got to go in for a delivery, and there's no one else to cover for her that can basically put an IV in it. So this baby's sitting a while she's dealing with this. Okay, unfortunately delayed due to delivery of another preterm baby. What is this? This registrar is having to prioritize things, and that preterm baby might have been a higher priority than our baby G. Again, where's her backup? Where's her backup? Her backup is a first-year GP trainee. That again, it's cruel to put that GP trainee into that unsupervised or without assistance. So, okay, called out of theater to, child B got apneic. Yeah, hello, was probably showing signs before you left. And Dusky, Dr. Brewery called in. Oh, yeah, he finally comes in. On arrival stats, holy cow, this is death stats at 50%. Oh, Jesus. Okay, all right. Sirens going on here. means they increase the O2 to 100%. Remember, if you can remember that you got to be careful with how much oxygen you're giving these babies. This is 100%, and this baby already has lung issues. Again, now if Dr. Shuley says 100%, then Nurse Jenny says, thank you, Dr. Shuley. Who am I to question? Receiving, this is something, I think this is bagging from the nurse. This would probably be the Neopuff. Heart rate okay. Took 5 minutes for SATs to, holy cow. Usually when it's an apneic thing, it's a pretty quick pickup. 5 minutes? Okay, so this all happened even before, I believe, Lucy might have done it, because then all of a sudden they moved to room 1. This might have been when Lucy then came involved. Pink and well perfused? Yeah, right. Yeah, right. Just because you're pink doesn't mean shit. There could be a bit, I've seen people pink and septic, okay? Or distressed, they get pink. It doesn't mean they're well perfused. Okay, with nasal CPAP at 100%. Okay, active. Are you active? Are you fighting because you're in massive pain? So tried for IV access ×2 unsuccessfully. Okay. Yeah, let's give this baby even more pain. Then had another profound apnea. Well, no shit, it's in massive pain. Heart rate, now the heart rate's starting to go down into the 70s. Ooh, that's a bad number for a baby. SATs, holy shit, that's death SATs. Perfusion down. We don't know what the CRT level is. Again, that's one of those blood markers. Again, and often that doesn't come until late. It may come early in the game, but a lot of times it doesn't come in late. Okay, now we're doing IPPV, which is a kind of a, again, I'm not sure exactly what that is. Is that might be even more than CPAP? I'm not real sure. And given with gradual improvement again, when SATs increase, perfusion also improve. Well, hello, you're saying he's well perfused there. What the hell do you mean here? Okay, decision to intubate. Yeah, due to 2 profound DSATs. Okay, so this might have been, I wonder if that was BiPAP, which is kind of like CPAP, only a little bit more involved. I'm not sure. It's not the intubation, okay? All right, so decision to intubate due to 2 profound DSATs and concerns, abdomen, do not, something about CPAP. Maybe they were concerned about CPAP belly. I don't know. No IV access. You're intubating and you still don't have IV access, woman. Where are you, Brewery? You're supposed to be here. Why don't you have IV access? You're supposed to be some big shot ass consultant. Okay. Intubated. Okay, so they put a 3.0 ET2 tube in. I'm not sure if that is the correct side. 8 centimeters at lips. Again, lips, that's the measurement they use to see if it's incorrectly. I do not know if that is correct or not. Bloodstained fluid noted coming up from trachea. Yeah, it's because it could be one or two things or both. It could be, let's face it, the baby has had a lung injury from birth. It could be coming from that, or it could be coming from, how kind are you in the intubation? Between cords, that's the vocal cords. Capnograph positive, again, okay, CO2 is coming out, but again, is it coming out correctly because the vents, you got the tube in correctly? Is it coming out correctly because the vent is picking up the good areas of the lung and not the bad areas? We don't know. A good physician who understands a vent would know what that means. And good bilateral air entry. Okay, so they're listening and they're hearing air going into both lungs. Dr. Brewery in attendance, well, he doesn't sound like he's doing shit. Vent settings now. They're putting this baby on a vent. I do not know if these are high or not, okay? I don't know if these are high pressure or low, okay? So if there's anyone out there that knows their vents that can tell me, please do it in the comments. I'd love to learn something. FIO weaned down to 30%. All right, I'm feeling better again. I want Shuli to tell me if this is correct. Good gas, 30 minutes post-intubation. Okay, all right, blood gas is good. Large leak noted in ETT. Oh, God, do you have the right endotracheal tube? But good airway into SATs, so left in. So you're thinking there's a large leak. It isn't just like a little itty bitty leak. You know, sometimes it happens, but you're a large leak and you're still leaving it in. Okay. All right. I'm trying not to scream, people. I'm trying not to use foul language. Okay. IV vitamin K given. Okay. All right. That's a clotting thing. Giving due to blood from trachea. That's a clotting vitamin. Approximately 5:30 had another profound DSAT. Heart rate down to 60. SATs to 40. That's death level, guys. Taken off vent. Well, okay. Will someone explain this to me? I mean, I am not that stupid. I wasn't born yesterday. As we say in America, I haven't just fallen off the turnip truck. Why the hell, if you've got a heart rate and a SAT that's, near death level, do you take them off a vent? I don't know. I don't know. Did we put them back on? Okay, Neopuff via ETT. I don't know. Capnograph still positive. Well, if it's still positive, why is this happening? Shuli, we need you here. Chest movement okay? Well, okay. Okay, you know what? I'm going to stop here, people. And we'll go back with the next one. I'll make it part 3. So far, again, I need to stop here and take a breather and just go do something fun. This is as sad as watching Schindler's List. Again, I am in no way denigrating those who went through the Holocaust, but damn, these babies suffered. Damn, these babies suffered. And I am not, although I'm sadness and I'm thinking of Lucy and my heart's going out to her in the prison, but I think if she could speak right now, she would agree with me that when it comes to sadness and everything, my heart needs to go 100% to them and not her at this moment. And she would be the first in line to say that is right. Bye-bye.